Awesome. Thanks, guys. Thanks for joining on time. So good morning, good afternoon, and good evening to the ISSUP family. It's an absolute pleasure to have you with us today on today's session on technology use and substance use disorder amongst youth. So really appreciate you choosing to spend this hour with us. My name is Goodman Sbergo. I am the scientific advisor at ISSUP, which of course means the International Society of Substance Use Professionals. So a few folks are still joining. So while we wait for more of these friends and colleagues to join us, I'm just going to start by saying a little bit about ISSUP, which a lot of you will already be aware of. So you'll know that ISSUP is a membership organization for the global substance use workforce with over 35,000 members worldwide. We are an international network that seeks to unite, connect, and really share best knowledge across the substance use prevention, harm reduction, treatment, and recovery support workforce. Our mission is to make the work of members as impactful, accessible, and as effective as possible. And we do this by really making it easier to discover and share evidence-based knowledge, best practice, training, and networking opportunities. So if you haven't done so already, please go ahead and hop on over to our website, which Coach is going to throw in the chat. It's issup.net, where you can find information about ISSUP and find out how to sign up for free membership and access to all these resources. So our website, in addition, has a wealth of resources and publications for you to browse and engage with and hopefully be enriched by. You can also watch recordings of past webinars and see future event listings. I want to thank the ISSUP staff in the background for providing the technical support for this event. So before we get going, I'd just like to go over a couple of quick items to let you know how to effectively participate in today's event. You're going to have the opportunity to submit text questions to our presenters by typing your questions into the question pane of the webinar interface on your screen. So please throw those questions in as the speaker presents, so we can be able to raise those to him. You may also send your questions at any time during the presentation. We'll collect these and then address these during the Q&A at the end of today's session. A recording of this webinar will be made available to you to watch on demand after this event. So don't despair if there's something you want to go back to. So we hope you'll stay with us for what promises to be an illuminating session on a topical and timely area of focus. Please do note that Spanish interpretations will be available and the details will be placed in the chat for your convenience. So getting to the meat of today, we're going to journey into technology use and substance use disorder amongst the youth with Dr. José Luis Vázquez-Martínez. Many of you would be aware of Dr. Luis Vázquez-Martínez, who is a physician who graduated from the School of Medicine at the National Autonomous University of Mexico with a specialization in addiction treatment and a master's degree in comprehensive prevention of drug use from the Universidad Veracruzana. He's worked at the Mental Health and Addictions Directorate in Mexico City's Ministry of Health, and he later served as the chief of the Department of Health Promotion and Prevention of Addictions at Mexico's Institute of Social Security and Services for State Workers. He's also worked as Deputy Director of Mexico's National Commission Against Addictions. And since 2012, he's collaborated as a specialist in the Inter-American Drug Abuse Control Commission, or ISSUP, in the Drug Demand Reduction Unit. So he has contributed to various specialized publications and is a tutor for several online courses. And so today, Dr. Vázquez-Martínez is going to present us with an overview of the available literature on how technology and digital media can facilitate networking amongst young people and at the same time expose them to their peers and advertisers' norms and related content. Dr. Vázquez-Martínez, a warm welcome to you. Good to see you again. And it's a great pleasure to have you with us. And with that, it's my pleasure to hand over to you. We look forward to your talk.
Thank you very much, Dr. Sbergo. You're a good man. Thanks, everyone, joining today's webinar. And thanks particularly to ISSUP for making this happen. It is very important for me to make this presentation. So I will start. You are now able to see my screen, and if you have any questions, just let us know through the box of questions and chat, whichever is easier or enabled to you as attendees. Well, today's session exemplifies how we have adapted to the abrupt and forced transition to the virtual world. Back in the day, I would have been in front of only some of you in a lovely location for sure, and very pampered by our ISSUP friends. Instead, I am honored to be the presenter in this webinar, which allows us to host more of you than could fit in any of our beloved average-sized venues. We're now quite familiar with holding many online activities through an internet connection. We can keep in touch with family and friends, attend classes, learn new things, work from home, receive the latest news, go shopping, participate in cultural, recreational, and leisure activities, receive care, and much more. In this context, we have witnessed the changeover, mainly in youth, from participating in outdoor activities to engaging in the digital universes within the devices in the palms of our hands. Besides hyper-connecting ourselves and facilitating some tasks, this shift to the online mode with high-speed access to permanently available connections has favored the emergence of novel issues that may lead to compulsive engagement. Behaviors such as betting and playing video games can more easily get out of control, produce significant discomfort, and lead to developing what may be considered non-substance or behavioral addictions. Although many of these topics continue to be studied and debated, they have an impact on people's lives. Neuroscience shows that substance use disorders like dependence and addictive behaviors like gaming disorders can alter neural paths in similar ways. From a neurobiological perspective, the chemical effects of psychoactive substances and the screen scrolling gesture required to enjoy the next short video on mobile devices are different elements that share a rewarding role for users. The variable gratification these stimuli can produce is crucial to perpetuating the conduct. In internet gaming disorder cases, brain imaging studies like the one I am showing on the screen identify neurobiological alterations typically present for other addictions, such as activation in brain regions associated with reward, as evident from cue exposure and craving studies and neurotransmitter system studies that indicate an involvement of dopamine-mediated reward mechanisms. Another alteration is the reduced activity in impulse control areas and impaired decision-making. And finally, the reduced functional connectivity in brain networks involved in cognitive control, executive function, motivation, and reward. The degree of influence on neural circuits depends on the stage of development. Of course, there is a more profound effect on still developing brains, such as those of young people. What happens inside the brains that are still developing and confer higher risk? Well, this clip might shed some light. The video, constructed from MRI scans of healthy children and teens, compresses 15 years of brain development between ages 5 to 20 in just a few seconds. This time-lapse movie is a representation of the neuronal pruning process, which remodels the brain's circuitry. Red color indicates more gray matter, and blue tones less gray matter. The changes in color from yellow, red to blue show the areas more actively involved in the pruning process, which prepares the brain to perform specialized tasks like abstract and multidimensional thinking. Alcohol, tobacco, and the other drugs can disrupt the neurochemical balance of this delicate process. And you can see this video shows clearly the process of developing, which is paired with the pruning process, neuronal pruning process that happens between those ages 5 to 20. Contrary to what people think, that after reaching 18 years old or 20 years old, you're fully mature, our brains are still developing, and that makes them vulnerable in a way, in a very profound way, neurochemically and neurobiologically speaking. A study published in 2012 investigated the correlation between white matter integrity and behavioral impairments in 18 adolescents with internet addiction disorder. The researchers used special tests and analyses to show the areas with white matter impairment. This is showed in color red on this slide, on the images of the brains that you can see on the screen. And here they detect brain regions with white matter abnormalities. This study showed that alterations in the white matter may be linked to some behavioral impairments. For instance, in the study subjects, there was a correlation between white matter impairment and an increased SCARED and ISSUP scores. The SCARED scale, meaning Screening for Child Anxiety-Related Emotional Disorders, is a valid self-report questionnaire that measures symptoms of anxiety disorders in children. And the ISSUP score, Young's Internet Addiction Scale, assesses how heavy internet usage negatively impacts social functioning and relationships. In a recently reported conference, an Argentine expert from NIDA, Rubén Valer, shared an interesting perspective on the effect that screens can have on youth. Dr. Valer recommended delaying constant screen exposure until at least after 16 years of age. In his conference, Dr. Valer described the social media addiction circuit, which is comprised of the 4 components shown on the slide. First, the emotional triggers. These correspond to the type of emotional needs that people have or need to quench or appease. What makes people involve or connect or participate in these social media circuits. It's not a neuronal circuit, but the circuit in terms of how do these work, how do these networks work. The second is the user's actions and gestures, such as likes, scrolls, and swipes. It's also, and as the third point involves the input, what we put into social media or into social networks. The posts that users make, the pictures we share, all the content we provide, we input into social networks. And this is a huge, large content that even is also marketed and merchandised in many ways, and unfortunately, sometimes also without our consent. And also a fourth component involves the reward. This is a reward very similar to the others produced by other stimuli like substances. But in this case, this reward is produced by digital involvement. It's what motivates people to participate into social media and to be part and interact or actively act in social networking or social media. In 2020, Navdeep Kaur and a group of researchers published the paper Associations Between Digital Technology and Substance Use Among US Adolescents. These are results from the 2018 Monitoring the Future survey. These researchers analyzed data from a sample of 44,482 adolescents in 8th, 10th, and 12th grade in public and private secondary schools. The highlights from their findings are the ones that you see on the screen. Social media and digital technology expose youth to substance-related content. Adolescents who use social media are more likely to use substances. The relationship, this relationship between these components is also observed across other forms of digital communication, and more socially connected adolescents are more likely to use substances. These are very important messages that are part of the conclusions or part of the highlights that we get from this important research. On the screen now you can see the histograms of past substance use prevalence by hours spent using digital communication or digital media among only 10th graders who are around, on average, 15 years old or around 15 years. Although there is too much data on the graph on the slide and the graphs are small, you can appreciate the more hours students spend using digital communication or digital media, the larger the reported substance use percentages. And we will be focusing on only some of these graphs for us to analyze these more closely. For example, if we analyze specifically social networking, how do social networking influence the reporting of substance use? Well, we can see here a clear pattern that tells us that the more time, the more hours per day these adolescents spend social networking through different type of devices. We might say that those are mainly through the mobile phone screens, but the more time adolescents spend, there is a larger percentage, there's a larger proportion of those adolescents reporting substance use. And this is not an anytime substance use which they are reporting. They report recent substance use, as you see on the screen. The colors provide the code or correspond to different patterns of use, like, for example, past 2-week binge drinking and past 30-day different consumption presented here, like drinking, using cannabis or marijuana, using electronic cigarettes, different flavors, or using electronic cigarettes for using or for consumption of cannabis or marijuana, and also electronic cigarettes used to get their nicotine fix, as they would say. This is very important because it gives you a powerful message of how big is this influence of the larger time or the more hours per day you spend involved in this social networking task. Well, there's a clear connection, there's a clear link that these subgroups will report a larger amount of substance use, recent substance use, as you can see here. And please always bear in mind that this is underage population. These are underage adolescents. We're talking about people around 15 years old, which of course shouldn't be in contact with this type of substances. We're not talking about, of course, casualty. We're talking about a type of link, a type of association, which is a very important one we need to study further in further detail. Let's go to another example. What happens if we analyze this relationship between the time or the hours per day spent watching videos, not any time, any day of the week, but only weekdays? Well, you see, there's also this relationship that it's more or less clear or clearly associated as the more time you spend watching videos on weekdays, it's more possible, it's more probable that you will be reporting substance use in a larger amount, that this population will be reporting larger amounts of substance use. And again, this is broken down into different categories of patterns of use, different types of substances. Okay, so it's also a clear way of looking at it. And we have even a very detailed contrast of this analysis, because we not only have the information regarding weekdays, we also have the information regarding weekends, which is the next slide that you can see on the screen. And what happens on weekends? Well, these people might be now in contact with their parents or their guardians or their family members or the people around them that at some point might have a role on the parenting or the positive parenting that they should be influencing on these 15-year-old populations, or around 15-year-old populations. And you can see now this relationship is not as clear as in the previous slides. So that's why you might think being supervised or being in contact with others that might not be also involved in the same digital behavior as these adolescents are, or this digital behavior we are analyzing, that might provide some way of curbing or controlling this effect. So it's also very important for us to understand the possible influence this parenting might have on the percentage of substance uses reported. When interacting with digital media platforms, we get exposed to various content, including marketing strategies like advertisements that openly seek to influence our behavior. Still, we also encountered more subtle elements, such as content curated by influencers and social media personalities. This is a study published in 2023 in the journal Addiction. And this study analyzed substance-related social media content. The research identified 73 studies that involved almost 60 million substance-related posts on Twitter, YouTube, Instagram, Pinterest, TikTok, and Weibo. As you can see, all these platforms might be considered as social media or social or digital social platforms, social networks. The posts that authors referred to, or the posts analyzed, correspond to text, images, and videos. And as you can see, the majority of studies pointed to e-cigarettes as the most substance-related content, followed by tobacco, cannabis, and so on. Only 4 of the 73 studies analyzed alcohol-related content. And here is important to think, Is there any type of regulation? Is there any type of controlling mechanisms that these platforms have or exercise or execute to prevent this exposure to this type of content? Well, that might give us a clue on this pattern of the different type of content identified in the studies that we see as part of this research. The research team identified 38 studies that analyzed what they call the sentiment of substance-related content on social media. They defined a positive sentiment, quote to quote, as content that promotes or encourages substance use. That's what how they call it, positive sentiment. It's the name of the variable analyzed. Interestingly, content related to alcohol consumption generates the highest positive sentiment, even though the number of studies that analyzed the content was the fewest. In contrast, the sentiment related to the opiate content generated more negative sentiment than rather positive. And by negative sentiment, researchers meant content that discourages or deters substance use. The analysis also showed that e-cigarettes and cannabis were the most common substances with content in social media, 4 of 5 platforms. This slide also shows that Twitter, or now called X, is a platform with the greatest number of substance-related content categories, followed by YouTube. And again, we need to think about what are the measures that these platforms have, what are the types of controls that these platforms have to curb or to prevent exposure to this type of content. So all this information needs to be organized, streamlined in different ways. So now let's take a quick look at the clinical criteria enlisted and described in the most recent edition of the International Classification of Diseases, or the ICD. It's the ICD-11, as you can see. And well, according to the World Health Organization, WHO, clinical entities related to substances and technology are classified as mental, behavioral, or neurodevelopmental disorders. This category contains the 2 groups that are relevant to today's session. For practical terms, we will focus on the disorders highlighted in blue. Disorders due to addictive behaviors are recognizable and clinically significant syndromes associated with distress or interference with personal functions that develop because of repetitive rewarding behaviors other than the use of dependence-producing substances. Disorders due to addictive behaviors include gambling disorder and gaming disorder, which may involve both online and offline behavior. And you might think, or you might ask yourselves, what happens with the other components we have been talking about, like smartphone addiction, colloquially known as smartphone addiction, or the internet gaming disorder? Well, all of these are still considered to be part of future editions of this International Classification of Diseases, but definitely, as long as these clinical entities produce discomfort in people or any type of symptoms, or lead people to ask for help, well, we should consider any of these as a matter of a matter that demands or requires or merits some type of attention, clinical attention. We should be able to provide any type of health responses, any type of services, psychosocial and clinical services focused on addressing people's needs when people face this type of problematic behaviors that, as we've mentioned before, might not directly involve, only for the diagnostic purposes, of course, might not directly involve the use of substances, but in some way might be connected with substance use disorders, or even share some of the, as we saw, neurobiological pathways that produce these type of problems or this type of clinical issues. So we will start also sharing some of the take-home ideas that I would like you to focus on. This is a very, very recent topic. So we are convinced that these topics warrant further research, with a particular emphasis on the long-term effects, since it's a very young matter for study. This is a very recent phenomena that we are studying. We still lack some long-term research in different populations from different regions of the world, involving different situations also. We should also dig deeper into the comorbidity and all the components associated with this type of clinical situations that we might find, unfortunately, in some of these populations. And as we saw, unfortunately, youth population is very exposed, and not only very exposed to different or through different platforms, particularly online and particularly through or on the internet, exposed to this content that might render them especially vulnerable to the influence of these either explicit or a little bit more subtle content related to substance use norms and substance use ways of using, or substance use even paraphernalia, not even the products, because that might be directly the publicity or the marketing or all the advertising, and that might be very controlled. But there are more, as we saw, there are more nuanced ways of presenting this information in a very well-hid way of delivering these messages to young people, and to make it appealing, particularly appealing to them. So it's a very important topic that we urge more research on, and that merits further investigation. Also, second idea is the behavioral problems related to technology use have similarities, very well documented similarities to substance use disorders. So it's not a surprise that they might share the same neurological pathways, and also even produce similar effects, long-term effects, and disable or produce any negative consequences on people's health in these aspects of their lives, because of these shared pathways or shared way of producing these effects. So it's key, it's critical for us to keep understanding and to know more about the the underlying mechanisms related to all these neurobiological effects of both components, the behavioral problems related to non-substance addictions, as people call it, and the problems related directly to substance use disorders or addiction, as we know colloquially in a more classic way. And definitely the most important part, I think we need to consider is how do we prevent, how do we intervene, how do we propose to control, to curb these situations? Well, there's a huge role that parenting, control, and positive parenting in particular might have. So we need to study what is the effect of these type of programs, of these type of interventions in the future. Is there any opportunity for action? Is there any room for improving the outcome, the future outcome in the long term, I mean, for this population by applying, by using this type of techniques or strategies? I think this is crucial. This is very, very important for us. And well, as a final reflection, I would like you to think on life on social media, which has on social media a different look. These digital platforms are especially designed to post beautiful, bright, vibrant, flawless products, even if they are available for sale or not. However, mental health problems and other issues might be hiding behind the evident and superficial appearing of things that is evident or that social media wants to show us or wants to grab with our attention with. This content is specially designed, specially curated for getting your attention, for involving you, for making this content very, very appealing to you. So always think that what you are looking at on the social media is in many cases very well produced, even professionally produced content that might be not what in reality you should be looking at. The reality might be very, very different. Well, that's it for my presentation today. It's only an introduction, I would say. It's only a general reflection. It's only some information, some food for reflection, food for thought, some ideas that I wanted to share with you, and some research that has been conducted recently and that provides important information that merits further analysis and investigation and research, and that you should be aware of, because many of the people that you are, many persons that you are in contact with, and many of those that you are trying to help or that you are providing services might face difficult situations because of all these effects that we are now understanding that particularly social media and the digital platforms have, especially in this post-pandemic world that, as you know, it has changed totally our world, the pandemic, and the way we conduct business, the way we do things, the everyday life has changed dramatically in some cases because of that. And unfortunately, that comes also with some components that might be harmful in different ways. So thanks for your attention.
Thanks, Dr. Vázquez-Martínez, for such an incredibly interesting talk. It's really amazing to see how social media has evolved from, this interface to initially increase connectedness, and has become this quagmire source for potential mental health and substance use risk and related challenges. And I think it's also unsurprising, just based on the amount of access there is to these platforms, that Twitter and YouTube are associated with the most, and you could argue the low-hanging fruit for exposure for the industry. So that's quite interesting. I think for me, what's an even deeper concern is the influence, the influencer culture, and how that influences the posting of substance-related content. You were speaking about how some of these pieces of content are professionally curated and specifically created to lure people. And the element of rewarding people. So some of the people don't even actually use substances, but they're paid to create the impression that substances are a core part of social life. I heard an anecdote when I was in Lisbon a couple of years ago about how part of the failing of ISSUP, screening, brief intervention, referral to treatment, is it doesn't focus enough on what the industry is doing. We focus so much on getting an extent of risk and seeing if people are at risk. But we're not actually looking at the additional factors that are impacting on people's exposure to substances. So we've got a couple of questions which we're going to get to, but I'm going to be selfish as the chair of the session and ask one first question before we go to those. And so my question is, should we be screening people for potentially harmful internet use? And where should this screening happen? Should it happen as part of routine screening, or should it happen if we're treating somebody for depression or substance use? Then we start to look at whether internet and social media are a factor. Where should we do this?
Well, thanks for your question, and thanks for your kind words. And again, thanks to ISSUP for making this possible. My opinion in clinical terms would be like, if we are thinking about screening, well, I always think of screening as a process that allows us to detect, to identify as early as possible in a large population a specific problem or flag something in these type of populations. So if that's the case, if that person is not involved in the health with the health system in some other receiving some other services or getting something from our systems, I think it might be useful, but particularly to focus on some specific populations that might be at a higher risk. It's of course complicated because we still do not have enough epidemiological data. We need a more detailed epidemiological picture to think in terms of screening from the public health perspective, as a public health strategy to address large amounts of populations. But if you are thinking of asking these questions that might flag a problem with how people is engaging with their social media, well, this is a different story if we're talking about a case of someone who is already with us because he or she demanded clinical attention for some other thing. In that case, it would make perfect sense to maybe not use this as a screening tool, but use these type of questions or think about this as a possibility as part of the whole integral assessment of the whole assessment we might do as part of our evaluations. So it's part of it. Yes, it might be an important component, particularly thinking about cases that we suspect have a higher risk possibility, definitely. But again, I think we still need more information in terms of how to use these as part of the public health tools under our belt.
Thanks, Dr. Vázquez-Martínez. So I want to just recognize all the great comments that we're seeing, recognizing the value of this particular discussion, which is quite timely, as we know, just the pervasiveness of access to social media. So a couple of questions, I might condense some of them into one. Jean-Pierre Risk, I apologize if I say your surname wrong, is asking, and I'm going to tie this to another question from Ken Winters. He asks, how can we draw the limits between the regular use and addictive use of internet and social media? If I can tie that to Ken Winters' question, where he says, are there any thoughts on the role of social media sites in implementing features that reduce teen indulgence on social media and to help parents monitor their teens' use?
Mm-hmm. Yeah, thank you very much. I think this is always something we need to calibrate in a very fine way, fine-tune this component, this situation, right? Let me just share again what I have here as part of this slide that I remember I talked about, for example, what happens, this transition from the outdoor activities that we saw as very clear in many, in large amounts of the population that now are different. And what happens when we first see someone as these kids, these children, getting this or involving in these outdoor activities, and suddenly, because of something, because of getting their first device, their first handheld device, portable devices, whatever we call them. I don't want to refer to specific brand, of course, but there are many of those very popular. Well, what happens? We might see an abrupt change, like it's very classic. What we see classically in other different clinical entities, right? Like someone with depression symptoms, someone started or was what people refer as a normal person, as a happy person, as someone who didn't show these symptoms at the beginning. And then suddenly something comes up, something changes, or maybe not so suddenly, not so abruptly, little by little too, but something has changed. When we detect these type of changes, we might start thinking about what are the clinical implications of that. And if we go back to what the World Health Organization states on the clinical references in the International Classification of Diseases, and I read it again, disorders due to addictive behaviors are recognizable and clinically significant syndromes associated with distress or interference with personal functions that develop because of repetitive rewarding behaviors, right? Like using these devices or getting involved in these social media platforms. I would say there's always this, the line depends, the line Jean-Pierre is asking about, depends on the clinical judgment people have. I think that's for now what we have, because we still don't have like a specific test, blood test or blood marker. We don't still have a specific genetic marker. We don't still have like a specific special neuroimaging test. All of these, we have been using it to get some clues. But nowadays, we still rely on the very reliable clinical judgment. That would be my recommendation directly.
Thank you. So I'm going to combine 3 comments into a question. So Nanda one says, nowadays technology is very important for studying. And on the other hand, there's a side effect. So, you know, how does one prevent and mitigate these negative effects? And Nanda, this is actually one of the questions I had placed. So you and I are on the same page there. So as we move towards tech-based teaching, you know, how does one mitigate this exposure alongside social media, etc.? If I combine that with Mohammed Kabi's comment, so Mohammed has said, are adults as addicted as adolescents? So if we're looking at particularly these populations that are moving into tertiary education, those are usually youth moving into adulthood. So as they are exposed to teaching and the risks, you know, linked with that social media exposure, are the risks the same for adults as they are for the youth? And then finally, Henry asks, with these two considered, what would be the recommended, I know this might, I know you may not have the answer for this, but you might. So what would be the recommended hours for technology use for young adults under the age of 25?
Well, thanks very much. First of all, I think all these questions are a clear indicator, or these comments and questions are a clear indicator of of the importance and the relevance of this topic. And I think definitely ISSUP should pay close attention to this in terms of this might be a very interesting line of research for some ISSUP members in the future, and also the ICU DDR and the others, because many of these we want to have like a very clear, very edge-cutting recommendation, like precise number of hours, for example. It's not crystal clear. It's not something that we can easily determine. It's not something that we say after 10 hours a day of being involved in any social platform, social media, you would become addicted, right? It's something that we just need, again, to start evaluating on an individual basis. Of course, getting involved or being involved in digital reality, being part of these digital worlds, might have also some side effects, not only in terms of the mental health and all these components. We mainly focus on the psychological and the well-being part. They also have some effect on the physical side of people, right? All these downsides of being sitting many hours, being quiet, staying put, directly linked, only moving your fingers for using for scrolling or navigating. It's also it will also have an impact on your body. So I think all of this is part of a cry out that we can listen from the ISSUP members, that this merits more research. We should be talking about this in the future. But again, just going back to the first comment you said of this last 3 that you combined, we also need to think of the mechanisms that will help us cope with this, that will help us curb this. And we already saw there's an effect of that, something that might be related or due to parental control. When these people, these 10th graders are watching videos on weekends, they report less substance use. So that might that is probably related to the presence of someone around them, controlling them, or even providing an alternative to being involved to social media. And as with any other potentially harmful element or component, like substances again, or any other component, you need guidance, you need control, you need someone, even in adult population, right? You need someone to tell you, oh, this might be too much for you. Now it's too late. Now it's something that you shouldn't be doing because you have other, or your priorities should be others, right? And well, the difference between adults and adolescents or youth in general is, as we saw, the particular, let's say, vulnerabilities posed by these changes, particularly in the neurobiological and development processes.
Thanks, Dr. Vázquez-Martínez. So your discussion leading into research, I think, is a nice way to lead into my final question that I'll pose for you today in these last 2 minutes of the session. And these will be a combination of the question from Travis Freeman and Maria Voduru. So Travis is saying, in terms of the research, during the research, was there any comparison with demographic differences? So given the differences between the prefrontal or development of the prefrontal cortex during adolescence, were males or females more impacted? I don't know if the research indicates that at all. And that links, I think, to Maria's question, just as the last question to ask is, what kind of research do you believe should be done? Where should it focus? Should it focus on high-risk youth, or should the research focus on the general population?
Yes. Well, thank you very much. Definitely research should be conducted or should be proposed as involving, well, trying to involve or trying to be directed or considering a larger variety of populations and groups, different ages. Of course, it's always useful to have the gender perspective. It's necessary, in my opinion. These data that I am showing today, these are some of these findings that I shared with you, might not have all the details, but in the papers, if you review these papers, and yes, this presentation will be recorded, the recording will be available on the ISSUP website, and I will be also sharing some of these open access papers on the ISSUP networks. So you can check those details in the specific papers, in the original manuscripts, and even many of these have some supplemental materials that you can further analyze. Yes, there were some demographics, since this is a study focusing only on one country. I didn't present all these details because these might be relevant only for that country in particular. But yes, there is some information regarding the other categories that we are always interested in that will provide more details. My recommendation would be to perform or to propose this future research as trying to capture all the variations or as much as possible, all the different components that we want to explore. I think it's always useful to link this research directly to the effect that we want to investigate, to know more about. We want always to get more information relevant to people, particularly in clinical settings, particularly information that will be useful for helping people, not only for collecting studies and nice epidemiological screenshots or pictures or surveys, but also we want to have this information to use it as part of our clinical practice, as part of our decision-making process, as part of our process to produce legislation and norms and many other things. So it's always my recommendation to go with this type of research that will produce results that the outcome will have some or will be of some use into our reality and quotidianity.
Thanks, Dr. Vázquez-Martínez. I'm actually delivering a talk just after this about translation of research into policy and practice. So that ties into my talk. So maybe I'll mention you in my talk. So
that's great. Awesome.
Thank you for such an amazing presentation, really topical, and for all the hard work you put into putting this together. Colleagues and friends, this really brings the webinar to an end. Thanks so much for joining us, attending. We appreciate you, and we hope that you've learned something new and that you enjoyed the presentation today. You're definitely going to get a follow-up email from us within 1 to 2 days, so 24 to 48 hours, with a link where you can view today's recording. And we always appreciate your feedback, so please do use the link in the follow-up email to tell us what you think, and be honest so we can continue to improve and give you the best as an ISSUP family. So on behalf of ISSUP and on behalf of our presenter, thank you for joining us, and have a really wonderful rest of your day. Bye-bye.
Thank you, everyone. Thanks, Dr. Goodman, Iveco. It was a pleasure. Thanks, ISSUP friends.